Hi, I'm Angie Settle with Your Health Done Right. I'm really excited today to have one of my favorite people in the world, in the volunteer world at Health Right, and also a board member at West Virginia Health Right, Dr. Michael Tupta. He's a practicing dentist. He has his own practice here in Charleston. He's had the pleasure of treating all 28 settles too, so that's part of the fun. So I can attest to his greatness. But he's here today. We're going to talk a lot about his volunteer work at Health Right, oral health overall, and just get into, all the stuff with oral health. So thank you so much for coming.
Thank you, Angie. It's a pleasure to be here with you.
So tell me, I always like to start with a little bit about you and your history and, how you got into dentistry, where you went to school, that kind of stuff.
Well, from a young age, I always wanted to be a dentist. Our family dentist, when I was a young person, had a big influence on me. I like the idea of having my own business, and dentistry is very much a profession where you can help people directly and you see immediate results.
Yes.
Someone comes in with a problem, with a chipped tooth or with discomfort, and in 15, 20, 30 minutes you treat the patient and you resolve the issue. So there's a lot of instant gratification with dentistry.
Yes, absolutely.
And I could formulate my own office staff and provide the best care that I can. So
and you do that for sure.
There's always been. Plus, there's a family history. I have two sisters that are dentists and one sister hygienist and two brother-in-laws that were dentists. So, but my parents were not dentists, but we're kind of a dental family. Yeah.
Absolutely, absolutely. So, tell me a little bit about where you ended up going to dental school and.
I ended up went to undergrad at Washington and Jefferson. I played basketball, and I went to dental school at WVU School of Dentistry in Morgantown.
Wonderful.
My sister who's 9 years older than me. She's my classmate, and we were very close all through dental school and helped each other.
Oh, well, that's neat.
And then I came to Charleston here back when I graduated and joined a practice, and then ended up I'm a solo practitioner. So I love West Virginia, love living here, even though I'm from Pennsylvania, Southwest PA. But I'm a West Virginian now.
Yes, you are, for sure. Blue and gold, absolutely. So tell me a little bit about when you started volunteering at Health Right, when that was, and what got you into that.
Yeah, years ago, whenever Dr. Grebe, Dr. Sammy Grebe, and Dr. Dave Walker started the clinic, I remember hearing about it in the dental community, and they had they invited dentists to participate. So I think it's over 20 years ago, I can't remember. But,
long time.
Yeah, we called in on our day off and said, hey, I'd like to come and participate and volunteer for a day. And so through the years, it's been changing. It's evolved into an incredibly efficient clinic. When we come here, the patients are appreciative of the treatment. The team here, the staff at Health Right is very well trained and very well versed in patient care and providing the necessary care patients need. We can't do all aspects of dentistry at the clinic. We pretty much provide preventive care, alleviate discomfort and infection, and do some restorative care. So it's something that is very much needed in our community. It's something that's very much appreciated, and the execution of the way the staff we see as many patients as we can and efficiently take care of their needs. So it's been, every time I come, I leave there feeling like I've helped someone and accomplished something.
That's good. I think that's what can be said about all of our volunteers, that we try really hard to cater to you guys when you come and make it as efficient as possible. But we want to make sure that they feel like they're given a good quality product, that they're taking good care of people. We tried to do better with like electronic medical records and even like the Panorex and making sure the equipment works good. And it's really hard to do your job and do it correctly, efficiently, if you're trying to work with antiquated equipment. So we do a lot of grant writing and all that to try to make sure that our equipment is always up to date for you guys. But I know the dental clinic is like so appreciative. Our staff is so appreciative of you. You're a regular. You come in like, every month, routine all the time. So I think your day's Friday, isn't it?
Yes.
That seems to be popular in the dental community.
Yes.
I guess Friday's the day that you guys kind of tend to not have practice, and so that's a popular day for volunteering.
A lot of people don't want to come to the dentist on a Friday because they think we're going to ruin their weekend.
Oh, okay.
So Mondays are usually a busier day because They waited all weekend. They want to come in on Monday.
Okay,
and
got it. Didn't know that.
We
Learning
keep
the
at least
tricks.
two appointments open every Monday because people over the weekend people always call in, and I don't like to put people off. So say
That's
come in
good.
at with this time and
Yeah.
take care of them.
Wonderful. That's great. So tell me, over the years, in coming at Health Right, we won't say names, of course, but some of the cases maybe that stand out, if you can think of anybody that you saw specifically, a
Yep.
situation.
Many of our patients are working and taking care of themselves and their families. Many of them are in service industries, restaurants, and different things. So people want to have a good smile. People want to feel good about smiling, speaking with the public. And one of my passions is cosmetic dentistry. I really enjoy restoring teeth to look natural and to look healthy and to be comfortable for patients. So when a patient comes in with a chipped tooth or with a lesion on the front tooth, we try and give that priority because that, when that's restored and the patient's smile is restored, that makes their life a lot more pleasant and a lot more enjoyable. There is a higher priority for patients. Number one, who are pain infection. Number two, in the aesthetic zone, where they smile, so they can have beautiful smile. And
Yeah,
beautiful
but
teeth.
I try to tell, everybody talks about, oral health. This title of this is Oral Health Matters. It matters so much, it's kind of the window to the soul and health-wise. But you think about people every day to day, the person that waits on you at the McDonald's drive-thru or at the convenience store or whatever, how impactful the smile is. And it really can impact people mentally,
Sure.
and it can impact their ability to go out and get a job and everything. So you can't really underestimate how important that is.
Yes.
And that's pretty amazing when you think about how many people that you're touching and how important that job is that you have, that you can change lives like that. We've had people come in really downtrodden, sad, they're covering their mouth. Somebody takes care of them great like you, and they fix it, and then they're going out and they're just grinning ear to ear.
Sure.
And it changes everything.
Sure does.
Changes the trajectory of their career path, financially, all of that. It really does.
Yes, there have been so many patients that we have changed their outlook and their attitude in life because we've restored their smiles, and they're living healthier, and it really is a mental aspect as well as a physiological aspect.
Absolutely. So we're doing a lot more there preventive-wise, because when I took over CEO, it was a lot of just eradicate pain and infection, which we still try to do. But, in West Virginia, we got, ways to go in terms of preventive care. So we're trying to do more, with the hygienical aspect and cleanings, preventative stuff, teaching people more. Because we've had people come in, in their 60s that didn't even know what dental floss was, had never used dental floss. So when you're looking at that kind of challenge, we've kind of chipped away over it over the years, and you've been instrumental in that.
Yes, I mean, dentistry has always been very prevention oriented. We always talked about, brushing your teeth,
Right.
staying away from sweets, staying away from soda pop, flossing, and home care is, if someone doesn't have good home care, they might as well not even come to the dentist, because
Exactly.
one of our jobs is to motivate the patient, educate the patient to say, here's what's possible, here's what we need to do. So, dentistry is both preventive as well as restorative. Things happen with, trauma or with caries, dental decay. You have to rebuild teeth, replace teeth, whether it's with crown and bridge work, dental implants, removable dentures or full dentures. There are different ways to restore missing teeth and to do that. So, but one of the things I wanted to share with you is one of the very interesting newer aspects of preventive dental care is analyzing a patient's saliva and understanding all of the different functions and aspects of a patient's saliva. In other words, you go to a physician, you have an examination.
Right.
One of the things they do is check the blood, and they look at blood and they look at all the different profile in
Right.
the blood. Well, in saliva, you have a patient. Let's say a family comes in, and there are 3 kids, and 2 of the kids don't have any cavities, and 1 child has 3 cavities or 4 cavities, and they come back 6 months later, and they have 3 cavities or 4 cavities, and they're pretty much eating the same diet. They're pretty much,
Same kind
it's
of
just the
preventive.
body chemistry of each person is a little bit different. So, each of us have certain bacteria, certain minerals that are produced in the salivary glands that the teeth live in 24/7.
Right.
So understanding that importance of, the amount of buffering capacity of the saliva, the amount of not only the acidity, but the amount of mineral content and the quantity as well. So many patients nowadays are on a lot of different medications.
Right.
And, for different systemic ailments. And a lot of those medications cause drying of the mouth or, lowering of the amount of salivary flow. So when you have a patient who has really good teeth and all of a sudden they go on a blood pressure medication or, a medication that causes decrease in salivary flow,
Right.
all of a sudden you see that their teeth start to break down. So understanding that ahead of time and having a salivary analysis to say, here's your salivary profile, here's what we need to work on, here's some things that we can give you can take to help counteract the
Wow.
the destruction of that.
That's pretty neat.
And I know at HealthRight, we are on the forefront of doing that. There's a company called Oral Genome where you take a salivary sample from the patient and you put it on an assay like a profile, and then you have it analyzed, and within 10 minutes you have a result to find out what the quality, what the quantity,
Right.
what the various profile of the saliva is, and then you can help educate the patient. It's not so much a diagnostic tool, but it tells the dentist and the patient, here are some challenges that we need to face. Here are things that we're going to need to help you augment your home care.
Yeah, that's amazing. Wow, that's pretty advanced, I bet, then since you started practice.
It is. Totally
That's
is.
amazing. Is that probably the most cutting edge thing that you've seen like recently?
Yes, from a scientific standpoint. There are always newer ways of, with 3D imaging to look at teeth and structures, look for cracked teeth, look for infections through imaging, 3D imaging. That's all a whole new technology
Yeah,
as
it's
well.
pretty exciting.
But as far as the science of chemistry, of body chemistry, and understanding
How it impacts oral health.
how it impacts oral health is critical.
Yeah, and I can't remember all the details, but we are working right now to do some of that, and I hope it expands because it'd be great for our patients as well.
Yes.
Absolutely. So just curious, since you started dentistry to now, we talked about this is a major advancement. What are some of the things that now I'm not asking you to give your age away, Dr. Stupton, but what are some of the major things that you've seen change, that like dramatic changes in treatment or things that you do different now than when you first started?
Yes, I've been in practice over 30 years, and primarily we've gone from restorative materials that were silver and that were gold, and gold is still good, but we haven't used silver in our practice in over 20, 25 years because there are dental materials that are a lot more biocompatible, that are more easier to use, and that will last. That will last and look like tooth structure whenever you replace it. So dental materials has been a big thing. Replacing missing teeth. It used to be just partials and crown and bridge. The advent of implant dentistry, where someone can lose a tooth, we could have a dental implant, which is just a little titanium implant that is placed in the maxilla or mandible, and that once that heals in after a few months and we place a tooth on that, it is very strong and is very durable, and it replaces the function that the patient has lost through missing teeth.
Yeah,
so you can do single tooth implants, you can do multiple teeth implants, even implant retained dentures, or where you place 4 or 5 or 6 implants, and a new denture is made, and that's gives the most stability and most likeness of natural teeth. So
that's amazing.
the advances that have been made in that arena of dentistry has just been
a lot more options now versus no teeth or dentures.
Right.
For sure.
Right.
Absolutely, that's neat. So tell me some of the challenges that you've seen, though. I mean, you can talk about our patients or your patients. What are some of the most common, I know we talk about dental disease, but what are the things that you're seeing on the rise, or more challenges, maybe due to diet, or things that you've seen just changes over the years that you're noticing?
We're always aware of oral cancer signs. Whenever we do examinations, we always look for, it's not just looking at teeth, it's looking at gum tissues, the throat, the oral mucosa, looking for any changes of color, consistency, lumps, bumps, things like that. So oral cancer is always something that's always looming that you're always thinking about. But patients, we have to understand that we're primarily responsible for our health. So if I have a patient who I know is drinking 4 or 5 Cokes a day, or Mountain Dew, or something like that,
Lots of sugar.
that has a lot of sugar and acid, that's a challenge, not only for the teeth, not only for the oral tissues, but as well as the stomach, the kidneys, the bladder,
Everything.
and everything. So,
Right.
so trying to educate people to understand that, this is happening because of the behavioral problem, the environmental issues that are going on.
Right.
We need to modify that, and it's not like as a very simple thing would be, someone likes to have a Coke whenever they have pizza or whatever. I always tell them, just use a straw. It bypasses your teeth. That acid and sugar really just stays in your mouth for a second, goes right down in your belly. You can have 1 Coke, have a pizza, and enjoy it. So this is not saying you can't have this.
Right.
You just have to have behavioral patterns that understand that if I wash this 1.2 pH acid over my teeth with phosphoric acid and sugar, 1 can of Coke has 9-10 teaspoons of sugar. So the combination of those two is very deadly for teeth, or very
Absolutely.
very difficult for teeth. So
Yeah, I know that's a challenge with teenagers. At my house, my kids we just never had soda in the house, so they're used to just drinking water or milk or whatever. But I know that can be a challenge, especially with today's society and fast food and how everybody, it's just so easy and convenient. And all these drinks that they come out with sugar upon sugar upon sugar, it's
sugar and
major
acid.
challenge.
A lot of those, not only sugar, but the pH of a lot of those health drinks or energy drinks is even lower than soda pop.
This is kind of off the wall, but have you seen anything tied to some of these snacks? There's some really super spicy snacks. I won't say the name on here. That even my kids have tried to bring home, and I just can't imagine that being healthy for teeth. I'm talking about a chip. There's a certain variety of chip that's super spicy, and I don't understand how it doesn't eat a hole in their stomach.
Well, not only that, but it also causes tooth sensitivity. One of the big things we deal with on a day-to-day basis, I would say 60 or 70% of the patients come in and say, well, I have sensitive teeth. And there are various reasons for sensitive teeth.
Right.
Primarily it's due to low acid content of the of the food, as well as the decreased buffering capacity of the saliva.
Right.
And sometimes there are areas where the gum tissue resorbs or recedes and exposes more of the tooth where the root is exposed.
Right.
And on the root surface, there's no enamel to insulate and to cover the tooth. So you just have open pores on the root of the tooth. And if you eat extremely spicy foods or low acidic foods or acidic or sugary foods, that dissolution of the root causes opening of the pores of the tooth and causes hypersensitivity.
Got it.
There are ways to treat that, but the main thing is to prevent it from happening in the first place.
Absolutely. Wow. So I remember when I was a little girl, do they even do this anymore? When they would give you these little pills or something?
The disclosing tablets?
Yeah,
Yes.
and then they would say, no, look at your mouth. And they were supposed to show you all the places that you weren't brushing. Do they do that anymore?
Sure.
Yeah, that always made you feel very guilty.
Yeah,
I need to brush more.
Right, anything where you can show the patient and
Yeah.
demonstrate the fact that I need to do this better, I need to work on this area better.
Yeah.
That's all part of the education process of patients.
Absolutely. How are we doing overall in terms of preventative? Is it getting better in terms of kids brushing and people taking care of their teeth? Are you seeing anything better overall?
Yes.
Even at I'm gonna say, I know in private practice is one arena, but even at health, right? Are you seeing that needle move any at all in West Virginia?
Angie, I really believe it has. In the past 30 years that I've been practicing, there has definitely been a move towards people retaining their teeth longer, their natural
That's
teeth.
great.
It doesn't, we still make dentures, but it's not like it was 30 years ago or 25 years ago
Not as bad.
where people just think, well, I turn a certain age and I need to get dentures.
Yeah.
Teeth were designed to last a lifetime.
Absolutely.
There's not a rule that says you hit a certain age. So understanding that I want to keep my teeth my entire lifetime. So what are the things I need to do to make that happen? And I think that, through the School of Dentistry in Morgantown, it's the only dental school in the state. And I think 95% of the dentists in West Virginia were educated there. So it has done a tremendous service of health service
absolutely.
for the people of West Virginia.
Absolutely.
People don't understand that as much, because if we didn't have a dental school in West Virginia, the dental health of our of West Virginians right now would not be nearly what it is right now.
I agree, absolutely. And it's great every time we, Dr. Grebe or anybody brings in another dentist and I bring them into the clinic and,
Right.
Ask them when they always, they graduated from WU. So I agree with you. It's went leaps and bounds. And it's hard to recruit people generally to rural areas, geographically,
Right.
challenged areas. And I think that really does help us as a state to retain those dentists.
Right, and there are
dentists.
different federal clinics that have sprung up around the state that provide care for more remote access areas.
Absolutely.
So those clinics are doing well, are doing what is intended to help their provide care to underserved areas.
Yeah, but there's usually like programs with the federal government and different ones even we've participated in where they do like loan repayment and things like that
Right.
to kind of incentivize
Right.
getting those providers. So it's a win-win, really. It is. It's
Right.
good for the community. It's good, of course, for the dental student because I know it's hard not to rack up a bunch of student loans when you get to
Yes, it
dental
is.
school.
I mean, that's a big problem right now for dentistry and medicine because right now, I think the average for a graduating dental student is debt of over $300,000
Oh, wow.
in that neighborhood.
Yeah,
And
that's hard.
starting out, that's a lot. And
Absolutely,
then you,
to chip away at that for
Yeah.
sure. Yeah, that's like a house.
yeah, exactly, exactly.
So tell me, I know we talked a little bit about it, but you're a board member at Health Right. You're actually our board treasurer, so you're multi-talented. Tell me a little bit about just that experience. I know it's totally volunteer, and it's kind of putting you on the spot because you're here with me, but tell me, kind of what makes you do that over and above your dental volunteering, because,
Well,
that's volunteer as well.
I so much believe in the mission of Health Right is to provide care for people in need, and anything that I can do to help provide that mission that we have, I want to participate. I'm not an accountant. I don't know all the finance things, but I do know that the clinic at Health Right has helped so many people, both the medical, the vision, the dental, and we've done so much good for people. So if I can help promote that end game of helping people, providing care, providing low, care for free, I want to do that. So
Yeah, and lucky for us, we have those amazing CPA people that
Right.
staff us and help support
To
us.
run the numbers, right.
Because even I run the clinic, but I'm not an accountant either. So, but they keep us in line. But it's great that you do that because over and above, your volunteer time, that's volunteer work as well. Coming to board meetings and executive meetings and all of that, and it's. It's other than us thanking you and the patients thank you, it's a thankless job because, you don't get paid for it. It takes extra time over and above your schedule and time from your family. So we're very appreciative of that. And
I'm just glad to help.
respect that
I
too.
really am.
I know you are. You come from a long line. Let's just go talk about that. Are we allowed to talk about your son? You come from a long line of people that give back. I'm talking about your son and being a priest.
Michael,
That's a neat
yes.
story.
Yes. So my son Michael, when
He was a dentist.
Yes, he went to dental school, and he was a very good dentist. And about his last year of dental school, he felt this calling that God was calling him to serve as a Catholic priest. So in his last year of dental school, he decided instead of coming to work in my practice, which was the plan all along, and I was going to retire at some point. He decided to do a year. He worked for a dental office in Wisconsin because he wanted to get by himself, and he did excellent treatment, and we went to visit him, and his office staff just loved him, and he loved dentistry, but God had a calling on his heart. So he entered the seminary, and he's in his third year. He's now studying in Rome.
Wow.
And he met Pope Francis last month. So
That's amazing. Do they ever
Yeah.
go up to you and say, hey, by the way, I got this? So
Well,
he's duly trained.
Yeah.
He can pray for you and he can fix your teeth.
That's right.
That's
that's right,
amazing.
That's right. And
I think that's the neatest story
and he
because he was always in the clinic.
Yes, he has a servant's heart. He loved
Yeah,
coming
he
to the
does.
clinic and assisting the other dentists and learning. And
Absolutely.
throughout his formative career, he would
Yeah.
love going there and volunteering. Yeah.
Yeah, so that tells me a lot about how he was raised, and then he's a chip off the old Dr. Tupta block because now you've got a Dr. Tupta / little Dr. Tupta / priest. That's pretty amazing.
Well, he's not there yet, but he's getting.
He's getting there. If he's in Rome, he's moving along. I think that's one of the neatest stories. So do you know, is he strictly going to do priesthood in the future, or do you think he'll be doing
No,
general priesthood? Or
And he'll probably do priest. Yeah.
yeah, that's pretty amazing, though.
Yeah.
I think that's a really, really
Somewhere in
unique
West Virginia,
story.
because he'll be in the Diocese of Wheeling-Charleston.
Yeah.
So somewhere in West Virginia.
That's amazing. That's amazing. And you have multiple kids like I do. How many
Yeah,
you
we
have?
got 3 girls and 3 boys.
3 boys and 3 girls. You got
Yeah.
it kind of even. So I got you by 2, but still, that's pretty amazing. But no, we appreciate you. We appreciate your whole family. You have always been very giving, and you were our volunteer of the year. I can't remember what year it was. I've been doing this so many years. I'm giving my age away. But we're so thankful for everything that you do and that you bring to the table at Health Right, and for being on the board and all of that. And we got a couple minutes, but we're about ready to run out of time. But we, October 19th, we had our successful We Care West Virginia Day. We saw 500 people.
Yes.
It was an amazing day to get that many people through. And one day, of course, we learned some things. We'll learn to improve it for next year. But wow, how efficient was that? I mean, we had the providers there at 9. I think everybody was wrapped up about by 6 or 7.
Yes.
The original plan was to be done by 5, but of course, it's hard to guesstimate how many to get through. But what an amazing event, and you headed up our dental department.
It was very well attended by patients. We had a very good response from the dental community in Charleston. Both dentists and dental hygienists and assistants, people wanted to come and help. We had a few dental students come from Morgantown.
Yeah.
We provided, care for patients, restorative care, emergency care, extractions, preventive care. I think we saw over 150 patients in a dental clinic in one day.
That's amazing.
I think we had 12 or 15 dentists, or somewhere around there, 10 to 12 dentists that volunteered throughout the day.
Yeah, it was
and,
great.
Dental hygienists, and like I said, the staff there is very organized, very highly motivated to accomplish our mission. So I think it was a very successful day overall.
Yeah.
We just feel bad for the people that were turned away, because we can only see so many.
But we got a list. So what we did was anybody that we couldn't get in, we're still getting them in. We're going to get them appointments and stuff at the clinic. But anyway, so you can mark your calendars. You heard it here first. Next year it'll be October the 18th. That'll be We Care West Virginia Day, second one. So mark your calendars, volunteers, and if anybody needs care. But I can't thank you enough for coming on today. Can't thank you enough for all the volunteer time that you spend at the clinic and the lives that you changed. And again, your son's not the only one with a servant's heart. You have one too.
Well, thank you, Angie. It's a privilege, and it's an honor to work with you and to serve the people of West Virginia.
Thank you so much. We thank you so much for joining us today.